All right, everybody, we are live. Jules is here. You want to pop in so you wave at everybody? This is my first webinar with a guest, so that's crazy. Let me just get organized here on my screen. I'm going to pull up my presentation. For those of you who don't know me, I'm Betsy Nettemeyer. I'm a board certified physician assistant here at True Body. I do all things functional. There we go. Today I'm going to be diving into supplements, kind of belaboring the effectiveness, where to get supplements, the good stuff about that. And then I'll be talking about a couple specific ones. Please post comments, questions in the chat. I will be checking that periodically and hopefully I can answer them as I go. But I want to get started because I want Jules to have plenty of time. Okay, let me change this. Okay, so how to choose supplements that actually work. So I want to demystify why some work, many don't, why the FDA doesn't regulate them like drugs, and how to identify brands that actually meet medical standards to help you guys choose the right ones. Okay. All right, the big misunderstanding. So why doesn't the FDA regulate supplements? So supplements are not drugs, and for good reason. I'll get into that here in a second. They're regulated like food, which is interesting, but in a good way. And they're a different legal category. So when you think about the FDA, a lot of people think like, well, maybe the FDA should step in and maybe that would be good because then we know we're getting a good product and stuff. There are some reasons why that might be helpful, but there's a lot of reasons why that actually would not be helpful. So let's get into the law of it. So the law that changed everything. So the DSHEA 1994, the Dietary Supplement Health and Education Act, is what defined supplements as kind of like a food. So there basically meant that there needed to be no FDA pre-approval, and it all will rely on the manufacturer's responsibility. So this was intentional for the public because we wanted to basically have availability of these supplements. We wanted to go to the grocery store, go to the Whole Foods store, and be able to buy them ourselves and pick them out and look and different brands. We didn't want to have to go to a provider and have them prescribe the supplement to us. So this basically allowed us access to supplements in a much different way. And this includes vitamins, minerals, and botanicals. And I'll get into it in a second, but if we were to classify supplements as a drug, most companies would disappear overnight because that would be way too difficult for manufacturers to be able to handle. So what certifications do supplements have? So we've got the GMP, which is the Good Manufacturing Practices, the NSF certification, the USP verification, third-party batch testing, research-backed formulations. So you have all these different certifications that they can get. Now, this isn't like a standard, right? These are just certifications. It's like maybe getting your, education in something, but maybe you're not certified in it. You understand it, but you didn't take the test to actually be certified in it, to get the little sheet of paper to hang on the wall, whatever that might be. So GMP basically means this ensures the supplement is made in a clean, controlled facility. So prevents any contamination, ensures consistency between batches. This is required for reputable companies, but a lot of companies maybe don't follow it super strictly. So this is the minimum. GMP is like the minimum. It's not the gold standard, but it's like the minimum as far as like certifications go. NSF, and you'll like when you're looking at a supplement on the shelf, you'll probably see like a sticker on it. This is like NSF certified or something like that. Certified being the key word there. They can follow NSF guidelines, but doesn't mean they're certified in it. So remember, like, words are really important here. So NSF certification basically means that it's third-party tested, that confirms like what is actually on the label is in the bottle. So there's no banned substances or any contaminants. Basically, think of it like most supplements probably do have vitamin D, right? But do they have like other things in there too that they're not telling you? Or is the concentration not exactly what they're putting on the bottle? So people can follow NSF standards, but don't actually carry a certification because it's easier for them to not have that certification because they can make a little bit different of a supplement for a little bit less cost and charge you more. So that's really important. USP verification confirms the ingredient identity and potency and absorption and dissolution. So basically, can your body absorb it? Can it actually like take what it's saying it's going to do, put it into the bloodstream and activate all the pathways that it's saying that it's going to? Will you be able to use it? That's basically what that means. Third-party batch testing is different than just like third-party tested. Batch testing means that every single batch is tested, not like one batch from 1987 was tested and it was good, and so it's a great supplement. It's every single batch. So this will basically verify purity, potency, and stability of every batch that goes out. And then obviously research-backed formulations. This is where most brands fall short because this is expensive. Basically, you're using this in a clinical study. You're taking a group of individuals, having them take this supplement and calculating the results, seeing what it actually does to them. So we're clinically studying it, and that's an expensive thing to do. So it avoids really cheap substitutes. But those are kind of the big thing. I have on the bottom here that the FDA does check on the top supplement manufacturers, but it's not necessarily going to tell you if it's a good supplement or not. They're just going to like pop in and they're going to be like, "Oh, is your facility clean?" Like those kinds of things, but that's about it. So, what does the FDA do and not do? So the FDA does have some oversight. Like I said, they can intervene when harm occurs. They can inspect manufacturing facilities, and they can issue recalls and warnings. So if like someone's taking a supplement or a couple people are taking a supplement and they have like the same negative outcome, the FDA can come in and be like, okay, we need to put a warning on this. We need to shut you guys down. Like we need to figure out what's going on here, what's actually in this substance or not in this substance that you're not telling people. So it's a nice thing that the FDA has the ability legally to step in those cases because it will remove some of those really negative supplement companies that are putting, absolute garbage in their supplements. But that's kind of like more of like the fraud and the harm kind of things. They're not necessarily approving a supplement company. Like I could just go tomorrow and just be like, I created a new line of supplements for True Body, and the FDA wouldn't be able to come in and be like, no, you can't. We got to approve all of that. I can literally just sell it to you. I can just say, this is what I put in there, and you better trust me. And I could go and get those certifications that I talked about in that first slide, but I also don't have to do that either. It wouldn't be until someone like had something harmful happen, then the FDA would come in and say like, you can't do this anymore. So I would always make you guys a good supplement, by the way. I don't think I would ever do that. Why supplements aren't regulated like drugs. So kind of alluded to this in the beginning, but what drug approval requires is proof of treatment or a cure, large clinical trials, standardized dosing, and hundreds of millions of dollars. And that's just ridiculous for example, someone like me who wants to create an amazing supplement for you guys. I don't have $1 million to just go out there and be like, I'm gonna do all these clinical trials. So it's really helpful for manufacturers to be able to do that without spending so much money. So let's talk about what it takes to approve a drug. So the FDA requires proof that it treats or cures disease with those extensive trials. So basically, if you're a supplement company, you can't say that on your label. You can't say like, this cures osteoporosis. This, what's another one? Like this reverses menopause. This lowers cholesterol to prevent heart attack. They can't say that. What they have to say is like structure or functional claims. Like this supports your immune system. This helps maintain healthy estrogen balance. This promotes bone health. Like they have to use different wording because they're not allowed to say that it cures anything because that would be a drug. And then it will have to be treated like a drug. And so that's really important because we don't want all of our supplements to be like gate kept by providers. Like we want to be able to go to the store and buy a vitamin D if we want a vitamin D. We don't want to go and have to get a prescription from a provider to sell us a vitamin D. So it's important that we have that wording in there, because it gives us access to all of these things that we really want to have access to. The important thing too is to understand that supplements, they're going to support our physiology. Drugs are going to do something entirely different. So a lot of times people are like, well, I don't want to take supplements. I don't even think they work. If you get them from a reputable company, you'll know that they work because they've done the clinical trials to prove it. There are manufacturing companies out there that work like drug companies who are going to go through the millions of dollars to do the clinical trials, and they're going to do those things just like you would a drug. And those are the ones that you want to find. And if you get those ones, then you will reap benefits. You will likely notice a difference. So medications force a change. Supplements support a process. Both have a place. One is not a replacement for the other. That's super important to understand. It's important to have both in your life for different reasons. It's just that depending on the manufacturing company, quality is optional. That's the difference. Okay, so if the FDA doesn't pre-approve, who protects you? Well, the company who makes the supplement, right? Like they've got to have like some great core values that they're not going to do you any harm. They've got to, instill the right processes to make sure they're going through all the appropriate checks and balances to give you an appropriate supplement that's very similar to drug standard quality. So that's where it comes in, and it's really critical, and it's really hard to find supplements that meet all those standards. If you go to a provider who does a lot of research in this, they'll probably help guide you down the right path. I, for one, am a big orthomolecular fan, because orthomolecular supersedes, has every certification that we labeled, but supersedes that and acts almost that every supplement is like a drug with clinical trials, and they have data to back each one of them. There's other supplement companies out there like Designs for Health, things like that. But you're basically relying on the manufacturer to keep you safe. So why do I use orthomolecular? Like I said, medical grade, not marketing driven, NSS certified, GMP facilities, in-house third-party testing, clinically dosed formulas, and practitioner trusted. You're not probably maybe even aware of orthomolecular. You're not going to be able to go to the store and just like see it on the shelves, because most of the dosing is like a clinical strength dosing. If you go through Fullscripts through our website, and you go to Fullscripts and you want to purchase something that's orthomolecular, you typically have to ask me for permission to allow you, which I will every single time. But basically they know that their supplements are so potent and so effective that they're nearly identical to a drug. And so you're going to see a difference. And they just want to make sure that you have a provider who knows that you're going to be taking it, because you're going to be noticing a difference. That's why I use orthomolecular. It has incredible, absorption, consistent outcomes, and less trial and error. So let's go into a couple of supplements that I just wanted to highlight. If you guys really want me to highlight a bunch more supplements when I'm done with this, message the spa or DM the spa. And I can always do like another webinar specifically focused on a bunch of different supplements, but these are the main ones that we focus on in office. So if you come in and you've done a get to know you with Maggie, she's going to probably have encouraged you to start all of these, because these are what I'm going to encourage you to start as well. And so you're like one step ahead of the game if you start on these. But vitamin D with K2, huge. So they need to be taken together. I'll get into why in a second, but we all know that vitamin D is super helpful for like bones, right? Getting calcium into the bones, helping with depression, helping with inflammation. But vitamin D is like the transporter vitamin. We kind of think of it like a hormone. Like if I'm giving you a bunch of hormones, they're just going to kind of sit there until they have vitamin D to take them around the body and distribute it in the bones and the organs in the brain. So vitamin D is super important, especially if you're on hormones or really any other medications, as far as transporting it where it needs to go. K2 is what's going to put calcium in the cells and not into the wrong places. So if you're a nurse out there, you probably have heard of someone being on like a blood thinner like Coumadin. If their blood gets too thin, we give them vitamin K. Vitamin K reverses it. So vitamin K, K1, not K2, K1 is a antagonist. So of the clotting. So it helps you clot. It helps you form blood clots on purpose. Not in too high of levels. We get most of this in our diet, but about 40% of us are deficient in this regardless. But K1 is really important for that. It's stored in the liver. K2 is a little bit different. So K2 is what's going to take the calcium and put it into the actual cell in the bone versus keeping it in the arteries. And I have a stupid story that I kind of describe when I'm talking to patients about this. It's like if vitamin D is the taxi driver and it's taking all the nutrients around the body through the vessels and depositing things in the bones and in the organs and in the brain, and it's like got a flatbed pickup on the back with everything loaded on and it's transporting things are going to blow off the back. K2 is kind of like your straps. It's strapping everything down so nothing can blow off the back. Calcium being the primary thing. So if calcium blows off the back and it embeds into the arterial wall is going to become stiff and it's going to become calcified. We see this a lot when we're doing x-rays on older individuals. We can almost like see their carotids on an x-ray because it looks like almost like bone, because on an x-ray we're trying to pick up bone calcification, right? And we can literally outline the vessels of the heart, the pulmonary vessels, the carotids. They're so calcified. They have maybe been a great vitamin D taker, but maybe they didn't pair it with K2. And so all that calcium is in the bones. So those vessels are very brittle, prone to stroke, heart attack, aneurysm, you name it. So you always want to pair it with K2 to make sure that calcium stays on that vitamin D until it's where it needs to be. And then it will release it. So K2 also, other than that, super good for lowering inflammation. It's a good anti-inflammatory and antioxidant. So people who are on a vitamin D with K2 have lower inflammatory levels of CRP and ESR levels, which are inflammatory blood serum markers. All-cause mortality is much lower in those with higher vitamin K2 intake. A study of 38,000 Dutch people over 10 years showed that those consuming the most vitamin K2 had the lowest diabetes rates, because we know diabetes is a big inflammatory state. So that was pretty interesting. It also can help with cramps and like muscle tightness. So a lot of times people are like, I'm still getting cramps and I'm taking all my potassium and I'm taking a magnesium and I don't know what else to do. K2 might be something else that you can add on. So that's a little bit about that supplement. Estrodim is next. I get a lot of questions about estrodim. If you're a patient of mine, you're on hormones, specifically any estrogen or any testosterone, I'm going to have you on estrodim. And that's just kind of like the policy. And the reason why, and truthfully, you could be on this even without hormone replacement therapy, because as long as you're making estrogen in some capacity or making testosterone in some capacity, you will have the metabolites below them. And I'll get to that in a second. But estrogen, it's not a hormone. It does not lower estrogen. That's the most common misconception. People, like my men, are like, why do I need to be on an estrogen supplement? I'm like, well, do you want to have high estrogen? They're like, no. And I'm like, great, then get on that estrogen. Same with women. Women are like, well, you have me on estrogen. Why do I need to be taking a DIM for it? And I'm like, has nothing to do with estrogen itself. Like, we want your estrogen to be nice and high. We don't want the metabolites below estrogen to be high. So it's a nutrient-based support for how the body processes and metabolizes estrogen. Think of estrogen like trash in your house. Estrogen doesn't stop you from creating the trash. It just improves how efficiently you take it out. So when it's broken down, there's different pathways for estrogen. One's a protective pathway that's great, causes you lower inflammation in the body, less proliferation, lower cancer risk profile. And then there's another pathway that causes inflammation, increases estrogenic activity and symptom burden of high estrogen. High estrogen people, your estrogen dominant people, like your PCOSers, they usually have like super bad PMS. They usually have They usually have like acne and hair growth where they don't want it. They usually have super heavy periods or regular periods. Like high estrogen sucks. And so making sure, you aren't making so much and getting so much estrogen dominance there. So estrogen can be really beneficial for those patients. So the goal is to shift basically estrogen metabolism towards the protective pathway and not suppress your estrogen itself, which is what that does. If you're a man and you're on testosterone, you're going to get some aromatization of that back into estrogen. And that's going to cause adverse side effects like acne and hair growth and hair thinning potentially, and other adverse side effects. You might even cry at commercials, things that you don't really want happening. So that's why we do Estrodim. Whether you're on hormones or not, this is a great supplement to have. Next supplement is CaloCurb. This is my favorite one right now. So think of this as like your oral GLP-1 only in supplement form. So basically this works with your physiology and not against it. It pairs very well with the GLP-1s by itself without GLP-1s, or if you're tapering off of GLP-1s. It's got a 30% decrease in hunger, 40% decrease in cravings, and 18% reduced in calorie intake. So works kind of like a GLP-1 in a lot of ways, and the statistics are almost as identical to the GLP-1s in a lot of patients. So Amerisate is the ingredient, which is a supplement. It basically stimulates the body's own release of GLP-1 and CCK 6 times base level. So huge. It increases those in a very, very large way. No other supplement on the market comes close to that. I think the closest one is probably 2 times baseline. This stimulates those that release 6 times your baseline, and it starts to work in an hour and it lasts 4 to 6 hours. So pretty remarkable. You take it before meals. The natural response basically to eating will follow. It's going to help reduce your cravings. It's going to help reduce your appetite. It's going to make you full faster, the whole thing, just like the GLP-1s. CCK is a digestive hormone made in the small intestine. It also acts on the brain, kind of like a neurotransmitter. So what it does is it triggers the gallbladder contraction. So when the gallbladder contracts, it releases bile. Bile is what breaks down your fat. So people who are eating things that have fat in them, they really want this to occur, right? They want you to break down your fat and get it gone. It also stimulates pancreatic enzymes, which they help digest protein and fat, and then it slows gastric emptying. So food stays in the stomach longer, just like the GLP-1s. That allows for better digestion. And you feel full faster. So that's satiety, which I think is one of the most fun things for most patients on GLP-1s is like, man, I just don't feel like I just need to eat and eat and eat. So really, really cool. I would encourage anybody who struggles with PCOS or weight loss, any of those things, appetite, hunger, cravings. This is a great supplement to add, whether you're on a GLP-1 or not. I highly encourage this. This is also an orthomolecular product. Reacted magnesium. This is one of the first supplements I reached for, to be completely honest. So magnesium is an abundant mineral in the body. It's found naturally in many foods, like leafy green vegetables. So according to the National Health and Nutrition Exam Survey, more than 57% of the population is deficient in magnesium. And I'll tell you why. Stress. stress. So basically stress directly inhibits magnesium in the body, like basically burns through it faster than we're able to replenish it. And most of us have high stress lives. Other reasons why it is reduced is because we have excessive intake in alcohol, salt, coffee, phosphoric acid found in soda, and diets high in calcium, but stress being primarily the big one. So the reactive magnesium is a fully chelated bioavailable form of magnesium designed to be absorbed and used by the body, not just like pass through the gut. A lot of times when we think of magnesium, we think of like constipation, like, is it going to help me poop? It will definitely help you with that, just kind of being more regular, but it's a super subtle. It's not like you're drinking magnesium citrate before a colonoscopy kind of magnesium, but it's a fun kind of magnesium that it'll just kind of keep you regular. when I say fully chelated, basically that means that it's bound already to amino acids. So it's just like ready to go, already there to be broken down. The body recognizes it as like a nutrient rather than like a mineral salt because of like how it's already formulated, which is really nice. So you have less GI upset, better cellular uptake, and your body knows what to do with it. Reasons why I recommend this: if you're on a GLP-1, this is really helpful to keep the bowels moving, for one thing, but it also is like if you have trouble staying asleep, falling asleep, if you have muscle cramps, tension, anxiety, or stress, if you're stressed at all, if you feel wired but tired, those are definitely reasons to make sure you're on a magnesium support. Headaches, migraines, those are huge. Constipation, like I talked about, it's gentle. So it's not going to be like your like a laxative. It's just a gentle support there. Exercise, recovery, hormone imbalance support. I think moral of the story is we burn magnesium fast, like faster than we can replenish it when we are stressed. So if you lead a stressful lifestyle, highly encourage you to get on some of that. True Adapt and New Adapt, I talk about these a lot. This has everything to do with cortisol. So these are called adaptogens. Basically, adaptogens is a natural compound that helps our body adapt to stress, not by forcing a reaction, but by stimulating, not by stimulating or sedating you, but by like regulating the stress response in the body. Adaptogens don't necessarily push the body in one direction. It's just kind of finding like a balance, if you will. That's why there's two different kinds, True Adapt and New Adapt. So True Adapt would be more of like helping you when you're like excessively fatigued from like low cortisol, like kind of helping you like get a little head start to the day, get things done, start your day when your alarm clock goes off, able to like wake up really fast, kind of do your thing. Because when we wake up, our cortisol should be peaking. And if it's not peaking because we're in a little bit of an adrenal suppression or adrenal fatigue, then basically we're not going to have any reason to like, we're going to snooze that alarm 50 times because we're so tired. We don't have cortisol to get us up and get us going. And so True Adapt kind of like helps you start your day, kind of like that resilience. New Adapt, think like nighttime, and nighttime is going to kind of like help calm us down. Like when we're trying to go to bed and we're like, oh, I forgot about this and that. And, I need to do this tomorrow. And I should have wrote that down. And I forgot to call this person back. Like that shouldn't be happening right before bed. That's going to stimulate you and that's going to keep you awake. So New Adapt just kind of like, let's recover after a stressful day. Let's calm it down. Let's go to bed. Let's kind of get things lower. So these work on the HPA axis, which is the hypothalamic pituitary adrenal axis for cortisol regulation. And that's basically how they work. It's truly regulation. Think regulation of cortisol, not force. Like we don't want to force your cortisol down. We don't want to force your cortisol up. We just want to regulate it so it's working appropriately. Most of the times that these two supplements don't have to be used long-term. Most of the time these supplements can be used just for a period of time, kind of reset everything, get that stress under control, and then we can come off of them. Okay, key takeaways. So supplements don't treat diseases, right? They're not a drug. Quality is everything, and certifications do matter. If you want any quality supplements, I highly encourage you to have a full Scripts account. So all of our patients, I create them a full Scripts account when they come in, or Maggie does when you guys do your intake. And that way you can get in there and you can browse the whole catalog. They have more than just orthomolecular on there. They have a bunch of different brands. And Full Scripts kind of pilots itself it's like a database that only dispenses companies and manufacturers who are getting all of the correct certifications, and they're having like a really good product, or they have third-party testing and good clinical trial studies. So as far as that goes, if you go to our website and you hover over shop, there's one that says, the line that says brands, you can just click on Full Script right there. If you have an account, it will just open you into your own account, but you can create an account there. You can purchase any supplements you want off there. Feel free. If it's an orthomolecular supplement, you click on it and it will send me a message saying person wants to be granted access to this supplement. I'll just go in there, grant you access. You're welcome to have whichever ones you want. Orthomolecular is just so great. Question on here says, do you do blood tests before starting True Adapt? Sometimes, not necessarily. Like, we can do really in-depth cortisol testing where you can do a saliva or a pee test, basically 24-hour testing of where's your cortisol. Is it peaking when it should? Are there speed bumps where they're supposed to be? Is it too low? Is it too high? We can do that. But actually, the research does suggest just like asking a series of questions. Like we could, when you come in and do your blood work at TrueBody, we do your cortisol every single time. And depending on the time of day, I can kind of gauge, like, is it in the range it should be? But kind of depending on your symptoms, we might do a more thorough test. The thing of it is like, if you tell me, when I go to bed, I can't fall asleep. I'm thinking about all these things. I'm so tired, but I'm just wired. Or I wake up in the morning, or I can't wake up in the morning. I'm snoozing my alarm clock. I just can't get going. I just feel so sluggish. There's kind of like a series of questions that I'll ask you. You usually fit one of them, in which True Adapt and New Adapt will be like a perfect either combination together or one or the other. But I'm always happy to do more thorough testing if you wish to. The studies just show that sometimes just answering those questions is just as good as a really expensive cortisol test. How are the adaptogens different from supplements like St. John's wort? Similar. They're definitely similar, different ingredients. So basically you're just looking at something that's working on that HPA axis a little bit differently. St. John's wort, it's going to have similar effects. It's going to work on the cortisol cascade in some way. It's just not working on that axis directly, if that makes sense. So the nice thing about supplements is there's a lot of them, and a lot of them can have like similar targets, like end targets of what they're trying to achieve. And so that's really great because a lot of patients need different varieties. Some people might get a really good result with one, and some might not, even though there's a lot of clinical trials to back it up. I will say that these adaptogens, based on the clinical trials, have more superior results for the majority of the population studied. So I don't want to say don't get St. John's wort, because I think it can be beneficial. And if you're taking it and you're noticing a difference, then it must be doing something for you. But they just work on a different area of the cascade. Also, you guys remember, I'm going to put this up here. If you guys, we're going to announce the winner tonight before I let Jules go on there. Just remember, if you are following TrueBody, you're following her, Vital Strength EMS, and you like the post, I think it was like the giveaway post that's on our grid. We posted that on the 17th, on January 17th. You comment webinar and you share it to your story, you're going to be entered to win. And Jules has probably a better prize than I do. I've got a supplement bundle for you guys. She's going to have, you'll get your first session where you kind of like test things out, get your settings dialed, and then 2 additional sessions. I'll let her talk about that a little bit more, but I highly encourage you. I can't tell you enough how significant me doing EMS therapy has been. I have noticed a drastic change in my workouts, in just my ability to do day-to-day tasks, to be, carry my kid, she's 3, just different things like that. After a couple of pregnancies, my ability to just like strengthen my core, to not have any urinary leakage, all of that stuff has been night and day different. If you have the chance to do a session or book several with Jules, I can't recommend it enough. It's for everybody. She's going to go through some contraindications, but I doubt any of you will have any because it's so great. She'll talk about that a little bit more. I think there's one more comment here. Oh, it's just thank you. You're so welcome, you guys. I'm going to turn it over to Jules. Just let me get a couple things set up for her. And remember, if there's any other supplements you guys really want me to like hash out, I am more than happy to do another webinar specifically on supplements. Okay, let me move this. Hide. Okay, sweet. I think you're good. Okay. The comments should be there. I'll be sitting next to you, so you're golden.
I failed the webinar. Hi guys. Wow, that was a lot of information. I just took a lot of notes. Thank you, Betsy. That was awesome. All right. Hi, guys. I'm Julianne, if you guys don't know me. I also go by Jules, so I respond to either. I'm super excited to walk you guys through some information about EMS, electromuscle stimulation, You'll also hear it be called electrical muscle stimulation or electromyostimulation. It's all the same thing, all EMS. It's transforming, just like tagging on to what Betsy said, it's transforming strength, mobility, and recovery in clients around the world. So today we're going to explore what EMS is, why we use MIHA Body Tech technology in our studio, and then how EMS works on the neuromuscular level, and how it activates deep muscle fibers. So again, if you have any questions, jump on. You can make comments and I will answer try to answer those at the end. So let's see, I need to go this way. There we go. Okay. Bear with me as I figure this out. Okay, so as I said, EMS stands for electromuscle stimulation. So it's a full body training method that uses controlled electrical impulses to activate your muscles. These impulses mimic the natural signals that your body already sends, only deeper, more efficiently, and with far less joint strain. These impulses are so effective that you really only do EMS for 20 minutes total. So your session is only 20 minutes. So for those busy professionals out there, this is key. You only have to do 20 minutes and it's equated to anywhere from 2 to 4 hours of strength training in the gym. Yes, it's true. Yes, there's been research studies on it. If you want those research studies, I can send links, all of that. But yeah, anywhere from 2 to 4 hours. So that is how intense this machine is on your body and on your muscles. So the intensity does determine your training protocol. We only do 20 minutes and it's only once a week. That gives your body time to recover. Your following day after EMS is going to be a rest day. As you build up after 4 sessions, the following day can be steady state cardio. If you don't want it to be a rest day, that's fine as well. Just keeping your heart rate anywhere between 120 to 130-ish, preferably. And then you can jump back into your normal routine, whatever that may be. So during an EMS session, you wear a specialized suit. What you see here on the screen is the vest and the straps. There's also a suit that goes on underneath this. I call it the base layer. The electrodes are then placed over the suit and it hits every single major muscle group that we have. As you perform the guided movements, the EMS impulses contract your agonist and antagonist muscles simultaneously. So what that means is that your biceps and your triceps, they're activated at the same time. Your core, your back, your hamstrings and your quad, those are being activated at the same time. So what that does is this creates a highly efficient full body workout. It requires far less time and far less joint stress than traditional training. So to understand EMS, it also helps to understand how your muscles contract. So normally your brain sends electrical signals through your nervous system to activate your muscles. EMS basically enhances that natural process by delivering impulses directly to the muscle. So this increases the intensity and the depth of the contraction. This allows EMS to recruit more motor units. I'll address what a motor unit is here in just one second, creating a more complete and efficient contraction than most people can achieve voluntarily. So a motor unit is comprised of the motor neuron, the axon, and the muscle fibers. So essentially what this is doing is when it's contracting and activating that motor unit, it's enhancing more of that muscle contraction, something that we can't do voluntarily just by ourselves, right? Or it's a lot more difficult. I can contract my bicep right now as hard as I can. The machine is going to do it more efficiently for me without the stress of me activating my bicep on my own. And a motor unit, say that 5 times fast. Let me know if you struggle as well. It's responsible for motor contraction and motor control. Because the stimulation your muscles work hard protected, making EMS ideal for individuals with joint pain, mobility limitations, or if you're recovering from an injury. Again, this is all a low impact workout. You don't even need to get into crazy dynamic movements if you don't want to, especially if you're recovering from any form of an injury. So traditional training relies on voluntary contractions. So that is when you're doing a squat, you are contracting, your brain is telling your quads, your hamstrings, your glutes, all of those to fire and to contract on your own, which means your body recruits the muscle fibers in a predictive order. So we start with slow twitch fibers first. That's your type 1. That's responsible for endurance. And then your fast twitch fibers later. And so those are your type 2 muscle fibers. Many people never fully activate their fast twitch muscle fibers, especially if you're a beginner, if you're an older individual, or individuals with any sort of movement restrictions. EMS bypasses that natural recruitment order, and it hits the fast twitch and the slow twitch, so type 1 and type 2 at the same time. So the impulses penetrate deeper layers of muscle tissue and activate fibers that are difficult to reach voluntarily. As I said, these deep muscle fibers can be dormant due to injury, age, or inactivity, but are essential for strength, power, speed. Also, those fast twitch muscle fibers are also responsible for those stabilizing muscles, which are super important after postpartum, but then also as we age. So for the elderly population, one of the main things is balance, right? I've lost my balance. I can't stand on one foot anymore. I go down to tie my shoe, fall over, that type of a thing. EMS is so important for the aging population, which all of us are aging, right? All right. So to review, in summary, EMS performs the following functions. So number 1, the deeper muscle fiber recruitment. EMS activates the type 2 fast twitch fibers, which are responsible for power, strength, and speed. These fibers are often under-recruited in traditional training, especially in beginners, older adults, or anyone with movement limitations. Number 2, increased motor unit activation. So EMS stimulates the motor units at once, more of them at once, creating a more complete contraction of the muscle. And then reduced joint load. Because the stimulation is external, you can achieve high intensity muscle activation without any heavy weights or high impact movements. The research that has been done on EMS has shown that it's actually contraindicated to use any sort of weight. So that's why if you've seen any of the videos that I posted, if you've jumped on the website, gone to the Instagram page, everybody's either holding very light weights, 3 pounds, or Pilates balls, because again, we don't need to actually be lifting any sort of weight while you're doing EMS. All right, let's go to the next slide. So why, wait, let me go back one. There we go. All right, Miha Body Tech technology. So at our studio, we exclusively use the German brand Miha Body Tech because it is the global leader in medically certified EMS systems. So Miha Body Tech is FDA cleared and TUV certified. It's a German certification. I'm not even going to try to pronounce what TUV actually stands for. It's in German and I would just sound like a fool. So I'm not going to do that. But it's essentially just like the FDA. So it's going to test for safety, quality, and performance. So they're also TUV certified, as well as FDA cleared. So Miha Body Tech is backed by extensive research and trusted in medical rehabilitation and athletic environments around the world. And when I say around the world, I literally mean around the world. It is in over, this product alone, this brand is in over 40 countries currently. Miha Body Tech has collaborated with scientific institutions for over 18 years. So they actually developed this whole body EMS system back in 2008. So that just shows you how long this has actually been on the market. They didn't bring it to the United States until 2019 because they wanted it to be FDA cleared. They wanted it cleared as a medical device. That is how it's used primarily, especially in, again, rehabilitation settings and with the elderly population. And so they didn't want to bring it here and just have it be something that you can pick up, right? You know, just go to Amazon and send some, order one and have it sent to yourself. Because it is a medical device, you can get injured if you aren't with a certified EMS trainer. So there are a lot of knockoffs out there that do not follow this same brand or the safety protocols. So I would very much encourage being a little bit more wary of those ones. They're not going to give you the same effect. They're not going to have the same stimulation level. They're not going to they're going to be inconsistent, all of that. So when clients train with us, they are using the same technology implemented in clinics, performance centers, and wellness facilities across Europe, Asia, and the United States. So Miha Body Tech is also the same brand that Usain Bolt, the Olympic sprinter, professional athletes such as LeBron James, and Hollywood celebrities such as Kim Kardashian and Jessica Alba incorporate into their daily routine. Again, Miha Body Tech has been used worldwide since 2018, and it's not just hype. Its reputation is built on quality, safety, and long-standing use in real-world fitness and therapy environments. This is not a trend or a gimmick. It is scientifically validated training method that is, again, used in over 40 countries. It's almost one of those things I have to tell people, you have to try it and experience it to believe it. It almost sounds hocus pocus. I totally understand. But if you try it out, then we'll talk. Then let me know what you think. All right. So one of the most remarkable aspects of EMS training is its adaptability. Because the intensity of the impulse is individually controlled, EMS can be tailored to meet the needs of virtually anyone. So teens, adults, seniors, those who just had surgery, rehab, postpartum clients can work with any of those sort of individuals. Every session is customized, allowing each person to work at a level that is challenging without any sort of comparison or risk, right? So going into the gym and I'm not lifting as much as this person, how that really affects our motivation and can be discouraging at the same time. However, since this is a medical device, there are contraindications that need to be addressed before the first session. So client safety is definitely our top priority. It is a medical device. So if you sign up before your first session, you have to complete a medical history questionnaire. This is just so I can review to make sure that essentially you do qualify, that you don't have any of those absolute contraindications. I'll jump into those now. So a couple of the absolute contraindications: cardiac pacemaker, defibrillators, or implanted electronic devices. This is due to the electrical impulse from EMS, which may interfere with the device function. We don't want to do that. Pregnancy, if you are pregnant or if you're trying to get pregnant, I also don't want to do EMS because there hasn't been any sort of research or clinical trials on EMS with anybody trying to get pregnant or pregnant. Of course, that never happens. Nobody's ever going to test on somebody that's pregnant, so we just don't do it. Uncontrolled heart conditions, including severe arrhythmias, recent heart attack, or advanced cardiovascular disease. Now, if you have heart conditions and they're controlled, you're taking medication, you follow up with your doctor, 100% you can still do EMS. It's the uncontrolled or anything that's acute, something that is just brought on, just come up for you. Like, oh yeah, now I'm starting to have heart problems, or now my back is hurting. Epilepsy or seizure disorders, EMS may trigger a seizure disorder if you already have these sort of issues because of the nerve activity. So I don't recommend it for anyone with epilepsy or seizure disorders unless it's approved. You speak to your doctor and get clearance. And I'd be more happy to, if anybody needs help with that, then yes, I'd be more than happy to speak to your healthcare provider. So active cancer or undergoing cancer treatment, again, unless it's been medically cleared by a professional, EMS has been used in other countries on cancer patients to help improve muscle atrophy, right? So how much chemo and radiation, how much of an impact that takes on your body. They have actually used EMS because, again, you could essentially just sit there in the suit, not do any sort of movements, and it's contracting and activating your muscles as if you were doing a heavy strength training workout. So that's kind of with a caveat. Yes, if you're having any sort of cancer or undergoing cancer treatment, if your doctor approves that, then yes, that's something that we can do. Severe circulatory disorders included advanced vascular disease or thrombosis, acute infections, fever, or inflammatory conditions. So EMS should not be used during active illness because it might make the symptoms worse, or it could slow your recovery. So basically, if you're sick, we'll just reschedule, don't come in. Same thing this is not the workout to do the night after going out. If you come in hungover, it's not going to feel good. EMS will not be a good thing to do when you're hungover. Just give yourself another day off, go do something else, sweat it out. Don't do EMS. Any recent surgery or unhealed wounds. So EMS, because of the straps and the muscle contraction, the electrical impulse, we're not going to put that over any sort of healing surgery wound, right? We still have stitches, things like that. Get through the recovery process, get that stuff removed, and then we can start EMS for sure. And then finally, any severe neurological disorders. So EMS may worsen symptoms or interact unpredictably with conditions that affect nerve signaling. Again, unless it is medically supervised, that's just something that we're not going to do. EMS training is not a replacement for medical care, but can be a helpful tool when combined with medical treatment. Same thing with rehabilitation. I'm going to jump into that a little bit later. So again, we'll be doing a comprehensive health screening and questionnaire. That's going to happen at the beginning of your session, just to see if there's anything else that we need to address before we get started. All right, so at this time, I want to transition and discuss the specific populations that can benefit from EMS training, which is pretty much everyone, but I'm going to just focus on a few things here, like postpartum benefits. We're going to cover the elderly population. We're going to talk about everyday athletes, those who have been inactive, chronic back pain, and rehabilitation. So those are kind of the main ones I'm going to be addressing. So after pregnancy, many women feel disconnected from their core muscles. EMS will help wake up these dormant core muscles. So if you think about after pregnancy, those lower abs, how it's very difficult to activate those without coning or doming, especially if you have diastasis recti. EMS activates those for you and is strengthening those for you without you putting any pressure on your diastasis recti, any pressure on your pelvic floor. So it's really beneficial for postpartum individuals. Postpartum recovery doesn't mean jumping straight back into high impact workouts, right? It's not like 6 weeks you're cleared. Now go and do a couple box jumps, throw in some burpees, things like that. You still need to, your body is still in that healing process, but you might want to still jump in and be like, hey, I want to get going. I don't just want to sit and do yoga or just do my stretches again. I want to move my body. This is where EMS comes in and is a very super helpful tool. So the technology allows new mothers to activate deep core muscles without strain or coning. It helps to rebuild the pelvic floor strength and improve posture and stability. That's because it affects the muscles right along the spine. So think about when you're feeding, holding your kid, usually maybe it's one side, you pop your hip up, that kind of a thing. So EMS helps to create that stability and mobility so that daily activities are a lot easier. You're not feeling so, I always held my kid on my right side. And so I would always feel like I was more like this, or especially with breastfeeding, I always have my head down and would just feel hunched over. So EMS kind of helps straighten everything out, especially with your posture. Because EMS is low impact and joint friendly, it offers a safe an efficient way for postpartum clients to rebuild strength and confidence. So again, after I had my third, my lower abs and my glutes, I could not activate. If I did any sort of lower ab exercise, I would immediately start coning right in that area, meaning that I was putting too much pressure and that it wasn't being activated down there. So I would stop doing the exercise, but I wasn't strengthening my lower abs. Same thing with my glutes. If I were to do any form of glute movement, my hamstrings and my quads would take over. Especially with pregnancy, we kind of tuck our pelvis under and we're always clenching our glutes. And so that makes them really weak, actually, rather than strengthening them. EMS has given me the opportunity to strengthen those without putting any pressure on them. And so especially with my glutes, I now have that mind-body connection again, because again, those went dormant. They were asleep. essentially, and I couldn't wake them back up. So my hamstrings and my quads would always take over. It's one of the benefits of EMS. It helps you reconnect, especially with that mind-body connection, so that now I know, okay, that's how I activate my glutes. Okay, they're getting stronger without me putting any of that unnecessary weight on them. All right, proactive aging. Aging is all about what can we do preventatively, right? The medical system in the United States, we kind of handle things once you already have an issue. This is more preventative. So what do I do now so that I continue to be active into later life? And if you are already in the later stages and feeling like, well, I've already lost muscle mass, all of that, incorporate EMS, you're going to find a significant change in your life. So as we age, even beginning in our 30s, we start to lose our lean muscle mass, as that's a process called sarcopenia. I'm sure you guys have heard of it. EMS has been shown to be an effective tool for preventing and slowing this decline by engaging deep stabilizer muscles, those fast twitch ones, those type 2, and activating your core. EMS supports better balance and coordination, key factors in fall prevention and confidence during everyday movements, right? And so a lot of those if fall, break a hip, especially in the older population, how detrimental that is to getting back on track. Older adults benefit from improved strength, better balance, increased mobility, and enhanced circulation. EMS does not require heavy weights or high impact movements. It is accessible even for individuals with arthritis, joint replacements, or limited mobility. In Germany, again, where this was created, it was used more in wellness of, hey, I'm in my 60s, but I want to keep hiking and I want to keep biking and I keep on doing these things for the next 20 years. And so that's what it's primarily used for. And that means more independence, right? If you can continue to be active and out and about and playing with grandkids, then that creates more of that independence without having like, now it's time for a nursing home because I need to walk with a walker or whatever it may be. All right, rehabilitation and EMS. So after injury, surgery, or prolonged activity, certain muscles may start firing effectively. That's when they go dormant, right? And when they do that, it's really hard to feel those muscles or again, have that mind muscle connection, like what I was talking about with my glutes after pregnancy. So EMS helps to re-engage these muscles by providing clear sensory feedback. So when the machine and the straps are on, it's like, oh, yep, there those are. Now I remember. This helps to build motivation, more control, and then also confidence in the movements that you're doing. EMS is widely used in rehabilitation settings because it allows clients to activate muscles without placing stress on injured joints or tissues. It helps to rebuild strength during recovery, improves neuromuscular connection after periods of immobilization. So again, that mind-muscle connection, and reduces muscle atrophy. So you can go in, have an ACL surgery, be approved by your doctor or cleared from your doctor. And once you start physical therapy, come in and start with EMS because you're just enhancing and improving your rehab ability there. EMS is a beneficial tool, but it's not a replacement for physical therapy. I would do that in conjunction, and it's just going to make your outcomes better. All right, next up. So everyday athletes. These are people who are out running, weight training at the gym, CrossFit, mountain bike, skiing, just enjoying staying active. EMS can significantly enhance performance. So this is what Betsy's talking about. She's our everyday athlete, right? Because EMS activates fast twitch fibers so efficiently and effectively, athletes can experience improvements in power, explosiveness, and overall strength. So this has been a game changer for my fitness routine as well. EMS creates a strong training stimulus without relying on heavy external loads. This helps athletes build strength and power while reducing stress on joints, tendons, and connective tissue. So it's ideal for longevity and consistency. It also translates into smoother movement patterns. It improves stability and better performance across your training. And it really helps prevent a lot of those injuries that we start to experience. Again, it's not a replacement. I think that EMS is always an enhancement to what you're already doing in your current life. So you would still go to the gym and then you incorporate EMS, again, only one day per week for 20 minutes, and you're getting the same effect as if you were in the gym. All right, chronic back pain. So EMS is actually the number one thing prescribed in Europe if you have chronic back pain. So their research has found that after 4 sessions, participants with chronic lower back pain improved by 80% after just 4 sessions. Again, because it's activating your lower back as well as your core, so your entire trunk at the same time. Whereas most people, it's like, well, I can't activate my lower back because it hurts, or this core movement hurts because my lower back. So this strengthens your lower back without you having to do any of those movements. So your muscles are being activated without putting weight on it, without you getting into a plank where you're starting to droop and you're feeling that pressure in your lower back. For individuals who have struggled to strengthen their core due to the pain of their lower back and those core movements, EMS often becomes the first method that allows them to build strength safely and consistently. All right, and then inactivity and EMS. So a lot of people have told me when they go online or they see, these pictures, for example, or they see our videos, they're like, oh, you must have to be like a total bad bee to do this, right? It looks super intense. And it's like, actually, you could roll right off the couch and haven't worked out for years. And this is the perfect thing for you. Again, it's all customizable. So it's not like you're comparing yourself to anybody else. Many individuals feel intimidated by traditional gyms, or they're unsure where to start, right? It's like, I don't even know where to begin, or lifting heavy weights and knowing how to do it properly, having the proper form, takes a long time. You don't just go into the gym and think, okay, I'm going to grab a barbell and do back squats. It takes some time to build up to that. But because these impulses help activate the muscles, clients don't need a high level of coordination or strength or endurance to begin. EMS reconnects the body and the brain, like we've been discussing throughout this whole webinar, helping individuals feel their muscles working even if they've been inactive for years. EMS also allows beginners to experience meaningful strength activation without heavy weights or complex movements. So this helps reduce the risk of injury. If you get injured right after you start working out, you're going to be more discouraged to get back in. It does create an early sense of success because you're seeing the improvements so quickly, because again, you're doing 1 20-minute session without weights, without crazy complex movements, but it's as if you've been in the gym anywhere from 2 to 4 hours of strength training. It becomes a powerful jumpstart toward better health, getting back into a fitness routine, improving posture, improving energy, and developing the confidence needed. All right, so just quickly here, I'm going to go over what your first session looks like. I want to be cognizant of time. I don't want to take up too much of your time. So your session will begin. I'll review that medical history questionnaire and any goals that you have. What is your goal for EMS training? How do you want to incorporate it into your life? I'll then have you get changed into your base layer. We're going to put on the straps and then do an impulse familiarization where I slowly turn on the machine 1 section at a time, starting with legs, glutes, going up the back, and turning the intensity to what feels comfortable for you. Big caveat here. Everybody keeps asking me, EMS does not hurt. It's not like a TENS machine where you put it on, it's like, oh, that's uncomfortable. It is not painful at all. Actually, the first time I turn it on, it's somebody's first time experiencing EMS. Everyone to this day laughs. They're like, oh, I wasn't expecting that. It's more of a stimulation. You get kind of a tingling, and then it goes into a tight squeeze. That's your muscle contracting. It is not painful. And it's different than that TENS machine where it really pulses. So after you do the impulse familiarization, we find your levels that are comfortable for you. We'll go through some guided movements, very static in the very beginning. You can build up to more dynamic movements if you want. But again, 20 minutes, time goes like that. Let's see. And finally, last thing, I just want to say thank you for joining. I hope that this inspired you to be interested in EMS. I love comments, questions, anything that you guys have. I know I just gave you a lot of information. It was probably very overwhelming. There's a lot more I could speak about, but I'm not even going to go there. On this slide, I have my website, vitalstrengthems.com. I also have Vital Strength or at Vital Strength EMS. That is the Instagram handle, and then my contact information. So
Couple questions.
Oh, okay. Let's see.
This one.
Have you worked with anyone with MS? So you know what? MS is one of the contraindications. You would need to get cleared. That one, I definitely want clearance from your medical provider. But yes, EMS has been used with MS clients, and they actually found, especially with that muscle atrophy, how much they've improved. So that would be something, because it does affect your nerves. That is something that I would want to either speak to your neurologist about, or again, I'd be fine to go in and do a presentation. A lot of this is actually about educating the medical population here in the United States. Again, it's very well known in Europe and technically across the world, but here in the United States, the medical population isn't that aware of it.
I would be happy to see you or anybody who has MS or any other medical condition that's a slight contraindication and determine if it would be a good benefit and provide medical clearance. Absolutely. I'd be happy to do that.
Do you work with any types of health insurance? It's not approved. It's not covered by health insurance yet. We're hoping, again, since it's not fully involved into the medical community here yet, because there are so many knockoffs. So it's about people like me who are certified in EMS training. It's about us going out, boots on the ground, and educating the medical providers in the area. And then hopefully as EMS builds in the country, right now it's very much in big cities, big fitness cities. So Denver, Miami, LA, those types of places. So more medical providers are becoming more aware of it there. We were talking about this on a conference call a few weeks ago with Miha Body Tech of how they were hoping in the next 5 years it will be more readily. Yes. Yeah. So not right now, unfortunately. I do offer discounts, and it's something you can just come and try out as well. But yes, no, not yet. Unfortunately, I hope so soon though. Is EMS effective on neuropathy? Yes, it is. Again, also a clearance from your doctor. What times of day do you take? Oh, that's the reactive magnesium.
I would take it at night because it can kind of like calm you down and make you sleepy. So that's definitely a nighttime supplement I encourage.
Okay. Also, I wanted to note here, within the next 48 hours, I put a code on here, webinar, all caps. If you use that at checkout, then let's see how I show that one.
Go to the banner right there.
Banners. That's what.
And then bottom one, show.
Okay, here we go. If you enter webinar at checkout, you will receive your first session free, but the code does expire. It's going to expire in 48 hours, actually, not 24, but 48 hours.
But hurry.
Yeah, but jump on it anyways. Well, thanks you guys for joining us. I'm sorry I went a little bit over. I know time is precious, so I apologize for that. If you have any other questions, like what Betsy said, message the facility. You can also message me at these links on the page.
And your website is www.vitalstrengthems.com.
Yep.
So super simple, super easy, very user-friendly. There's a lot of information on there too. And that's where I purchased my packages. And yeah, you would just enter the promo code, all caps, webinar.
Yeah.
So I highly encourage you to at least try it. Because like Jules was saying, that first session, it's kind of a mental game changer of how just doable it is. And once you start to see your results, you're addicted. It's so great. I felt like I was levitating. One time I was like, had my kid carrying her, bent down to grab something she had dropped off the ground and just popped right back up like no problem. And I definitely attribute that to the EMS therapy because I was already working out and that was not the case. So really, really awesome stuff. Yeah. I probably won't ever go without it.
Yeah. It's awesome, guys. Come try it.
All right. Any other questions? We're going to close it out. You guys, thank you so much for attending.
Thank you.
Bye.